think LDL is extremely relevant for heart disease, watch my video where I destroyed vegan gains on the LDL thing.
Bye.
Bye. Have a good day at work. Kiss me. Love you.
Bye.
Have a good day at work. Watch my video on vegan gains exposed with the LDL heart disease thing. Okay, if you listen to my points, you'll understand the evidence of LDL causing heart disease is extremely fragile. How's it going, you guys? So in this video, I just wanted to share a recent study that I came upon and found extremely fascinating. This study is called the A to Z weight loss study, and it's a randomized controlled trial which compares the Atkins diet to the Zone, the Ornish diet, and the Learn diet. And for those of you who don't know, the Learn diet is basically a traditional diet based on the American food pyramid guidelines that also includes exercise and meditation. And you know, the Ornish diet is very popular for being one of the very first diets clinically proven to halt the progression of heart disease, to prevent heart disease, and in some cases reverse heart disease as well. It's essentially a vegetarian diet, virtually fat-free or super low in animal fats. The Zone diet is essentially a balanced diet, which by Dr. Barry Sears, I have his books, and it's basically equal amounts of carbs, proteins, and fats. And this particular version of the Atkins in this study is the induction phase, phase number 1, where essentially it's a ketogenic diet where they keep carbohydrates below 20 grams. And in this study, they're comparing the diets, and so the Zone, the Ornish, and the Learn diet are calorically restricted, where they specifically have the study participants restrict calories. And the Atkins, they're actually told they can eat as much food as they want as long as they're keeping their carbs below 20 grams and eating only the meat, fish, eggs, etc. So as long as they keep the carbs below 20, they can eat as much as they want and don't have to worry about calories. Whereas the others in the group have to restrict calories. And yes, it is done on overweight women before menopause, which is fine. So I don't see any reason why that would be a big deal. Now, here are the results of this study, first of all. And by the way, y'all should look up that study for yourself and read the full text. I'm not keeping anything from you guys. So this is a graph I posted onto my Instagram. Follow me if you haven't already. Keto Conqueror. Yes, I've changed my name back to Keto Conqueror simply because I'm fascinated with the ketogenic diet and all the benefits associated with it. And also just because that's naturally what I've been posting most of. I'm basically the athlete that follows the ketogenic diet and doesn't feel like he needs carbs to perform. So that's what I'm rolling with. But anyway, here's a graph showcasing the results from the study. So essentially, Atkins compared to the other diets, the Atkins diet. This is at 12-month follow-up. So they followed the diet and they followed up with the participants after 12 months. Atkins adherers, they lost double the weight. They lost double the triglycerides. They improved their triglycerides by two times. Their HDL increased by 5%, and their blood pressure decreased by about 5%. So their blood pressure improved double that of the Ornish diet, actually triple that of the Ornish diet. On the Ornish diet, their blood pressure went down by 0.7, whereas the Atkins, their blood pressure went down by 4.4. And blood pressure is an immediate indicator of heart disease. Blood pressure decreased by 4.4 points, whereas Ornish only 0.7. That's significant. Another thing is that the sample groups in this study are all equal. There are about 70 participants per group. So it's not like Vegan Gains study on LDL where the people with the lowest LDL, there's only 2 people with low LDL. So if you haven't seen my video on why the LDL theory is nonsense, then look for my video on vegan gains and his LDL theory exposed, where I explain very clearly why the evidence he uses is nonsense. Not only is it done on statin drug treated patients and has nothing to do with diet, but the sample groups with the lowest LDL and no heart attacks, there's only 2 people, versus the people with the highest LDL, there's 200 people in that group, and 100 people with an LDL of like 200 didn't have heart disease. So that tells you more people with high LDL have less heart disease than the lower end. It's ridiculous. Watch that video if you haven't already. You got to be a fool to think that high LDL causes heart disease. It's crazy. Anyway, on the Atkins, blood pressure went down by almost 5 points. Ornish only went down by about 1 point, not even, like 0.7. HDL did not improve at all on the Ornish diet. HDL actually went down on the traditional diet, which is not good. HDL increased by about 2 points on the Zone diet, because Zone emphasizes high monounsaturated fats but low saturated. So at least a modest increase in Zone. Ornish is a virtually zero fat diet, so that's why the HDL didn't increase, because there's no dietary fat to provide that. Traditional diet, HDL probably went down because of the polyunsaturated omega-6 fats, which are highly inflammatory and decreases your good cholesterol. Whereas the Atkins diet is very high in monounsaturated and saturated fats. A lot of people don't know animal protein, especially pork, lard, the fats that the Okinawans traditionally used to cook with, is very high in monounsaturated oleic acid, which is the good monounsaturated fats found in olive oil and avocados, which has been found to decrease risk of heart disease and increase your good cholesterol. And so that might explain why the Zone diet and Atkins increase HDL, because it's high in monounsaturated fats. Interestingly enough, the high saturated fat content of Atkins did not mess with the increase in good HDL. So Atkins decreased triglycerides by 30 points. That's double of the traditional diet and the Ornish diet. Chances are the only reason why these diets lower triglycerides is because they're calorically restricted. Although I'm not sure. The Zone diet, for some reason, the triglycerides only decreased by 4, which is weird to me. But the Atkins doubled, and they aren't even calorically restricting compared to Ornish. Triglycerides are a large indicator. Triglyceride to HDL ratios are a huge indicator of heart disease and also diabetes. LDL increased by a measly 0.8%. Okay, 0.8 points. Again, watch my video where I talk about why the LDL theory is nonsense. I don't know why people believe that studies done on statin drugs, there's a linear increase in heart disease, like a linear correlation. That's not true. There's no causal relationship. Only in studies done on statin drugs. So LDL increased slightly, but triglycerides drastically decreased and HDL drastically increased. So a drastic decrease in triglycerides, drastic increase in HDL, and a slight increase in LDL. Sounds like at the very most 2 steps forward and 1 step backward. That's still 1 step forward. Atkins lost 10 pounds compared to the Ornish and the traditional diet, and they're not even calorically restricting. So yeah, again, everybody should probably look at the full text of this study yourself. And it's not funded by Atkins, okay? It's funded by the government. It's a government-funded study, It has nothing to do with Atkins funding or anything like that. So, in my opinion, so what are the reasons? Why did they get these results? So, first of all, a huge risk factor for heart disease is insulin resistance. It's what they call metabolic syndrome. I personally don't believe that the only way to reverse diabetes is carbohydrate restriction. I think you can reverse diabetes through many different methods. Obviously, Ornish and other vegetarian and vegan diets can reverse both heart disease progression and diabetes, although I don't believe that it's the optimal long-term strategy, especially for well-being, and it's not the only way, especially when you can you can actually reverse heart disease using an Atkins diet, or better yet, you can reverse diabetes using an Atkins diet. Point is, though, so Atkins drastically lowers your blood sugar, and it drastically lowers your insulin because you're eating high protein, high fat. So protein increases glucagon, and glucagon is essentially an antagonist of insulin. And when you have lower insulin, lower blood sugars because you're not consuming any carbs and you're consuming high protein, which increases glucagon, that keeps your blood sugar down. Low blood sugar means low triglycerides, okay? And blood sugar tends to decrease HDL. And HDL is an indicator for basically anti-inflammatory. It's anti-inflammatory, you can think of it as. People with higher inflammation, higher disease, whenever you're sick, you have low HDL. HDL has been strongly correlated with longevity. They've actually identified a gene that has to do with HDL, and basically people with genes that favor high HDL tend to live past 90 and 100. That's one of the main commonalities between all centenarians is high HDL for some reason. And most experts, most doctors, medical doctors, they follow a risk factor protocol for heart disease, where if you have insulin resistance and obviously the smoking and the exercise and sedentary behavior and all that, combined with your HDL to triglyceride ratio, they tend to go by blood pressure, triglycerides, and HDL and LDL as a means for preventing heart disease or diagnosing heart disease. So basically what I'm saying is doctors don't look at, oh, you have high LDL, therefore you're going to have heart disease. They look at, okay, you have high blood pressure, your cholesterol is high, and you have high triglycerides and insulin resistance, and you don't exercise. We've got to do something or you're going to have heart disease. Doctors don't look at just, oh, you have high LDL and total cholesterol, let's put you on statin drugs and you're going to have heart disease. Many doctors do, because statin drug companies need to sell their products. So they try to get doctors to put their patients on statin drugs prematurely. And it's an epidemic. Statin drugs are highly overdiagnosed in the US, but most doctors I've talked to, they all agree it's not just a cholesterol level thing. There's a multitude of factors that they look at. And on blood panels, it's blood pressure, it's HDL, or on the testing protocols, they look at, okay, high blood pressure, insulin resistance, and their hemoglobin A1C, triglycerides. These are what they look at to predict heart disease. They don't look at just LDL. And Atkins keeps your blood sugar low, keeps insulin low. You eat a lot of healthy fats. I honestly, from what I've seen and experienced, I believe humans are mostly carnivorous. They're meant to eat primarily animal foods and then only a small or a moderate amount of plant foods. This would explain why Atkins and other ketogenic style diets tend to produce better blood lipid profiles and effortless weight loss. Animals in the wild, they don't need to calorically restrict to lose weight. These diets that the Atkins was compared to, they were calorically restricted, whereas Atkins, they didn't calorically restrict, and they just happened to probably eat less calories because these foods produce favorable hormonal changes in the body that allow you to eat less over time. Not to mention your body can't really burn body fat because it has to burn the sugar first. And only after you burn the carbohydrates can you start to tap into your blood or your body fat stores, which kind of tells you the body wants to burn fat, which is why it stores carbs as fat to burn later. But it can't burn fat until it's burned all its carbs first. So, I mean, there's plenty of studies, plenty of science that I can show you guys to back up everything I'm saying and to explain the mechanisms behind the Atkins diet producing these favorable results. But I just want to get this study out there. I didn't think this type of study existed, but it does. So let me know what you guys think. I mean, another thing is that high animal protein and animal nutrient consumption actually increases the conversion of homocysteine into glutathione, as long as you're consuming the yolk with the egg or the fat soluble nutrients with the protein. Vitamin B12, B6, and choline actually convert cysteine and methionine into from homocysteine to glutathione. Glutathione is your body's master antioxidant, which will lower inflammation, raise your HDL, and prevent the arteries from becoming inflamed. I have a video on this, and this is another half-truth that vegans will tell you, is that when you consume cysteine and methionine in animal foods, it increases your homocysteine levels because they're precursors to homocysteine. Yeah, guy, but if you also consume choline, vitamin B6, B12, these nutrients are found in animal fat, and they actually convert those amino acids, those cysteine, methionine, and the homocysteine into glutathione. And they don't tell you that. They don't tell you that glutathione is your body's master antioxidant that's more powerful than vitamin C. Vitamin C's main mechanism is to recycle glutathione. But why would you need to recycle glutathione when you're eating foods that directly produce glutathione? Again, it's the propaganda promoted by vegans. Crazy. Alright, leave your questions and comments down below, and I'll talk to you all in the next video.